Have you been wondering whether it's your thyroid gland that is in dysfunction mode or is it the adrenal gland? We often tend to get confused because both of these glands are the ones responsible for energy. Now, before we get deeper into it, let me just give you a glimpse about what exactly these two glands are. Thyroid gland is the one which is located at the neck, whereas adrenal gland is a pair of glands located on top of your kidneys. When there is a dysfunction in them, both of them makes you end up with fatigue, forgetfulness and depression. All of the endocrine glands functions in a tandem, as in when any one of the gland gets affected, in the due course the other glands also gets affected. Same is the case with thyroid and adrenal. If there is constant stress, both of these glands tends to get affected, be it physical stress or mental stress. And that is because the adrenal gland, which comes up with two hormones, which is cortisol and adrenal, both of these hormones are secreted whenever there is a stress situation. And when there is prolonged stress, initially the cortisol will be able to take care of the stress situation. But as the gland wears off because of the continuous production of the gland, and this leads to hypothyroidism and hypoadrenia. Now, before we get into the remedies for the same, let us try to understand how the adrenal hormones, which is especially the cortisol, helps in the functioning of thyroid gland. When there is high levels of cortisol, eventually it helps in the normal functioning of the gland. But eventually what happens is high cortisol leads to impaired conversion of T4 to T3. It hampers the production of TSH, because of which again the levels of T3 and T4 gets reduced. There is magnesium flush out, which is the one responsible for the conversion from T4 to T3, and this eventually leads to anxiety, insomnia and also muscle cramps. And in the long run, it also reduces the cell reception, because of which the T3 gland won't be able to function on the peripheral cells. Now, that being the case, what can be done? Ayurvedically understood, you have to either reduce the amount of stress or reduce the changes that has happened in the body because of the overfunctioning of these two glands. And that is where the common herbs like ashwagandha, blue pea, dry ginger powder, kanchanara comes into action. When consumed in the form of concoctions, tablets, best under the supervision of an expert, they help in regulating the functioning of these two glands. Initially, these concoctions will do the job, but if you are looking for a complete reversal, fixing or curing the condition, then in that case you are going to need the help of an Ayurvedic expert, because then it is a long-term treatment which includes minimum 3 stages of treatment. So, for further assistance, it is best recommended that you meet an Ayurvedic physician who can help you with a holistic healing and not just treating any one gland in your body. Hope that helps.